first got to know Paul Ockelford back in 1962 as 10 and 11-year-olds locking together in the 6A rugby team. Later on, we played rugby together in the first 15 for a couple of years. Even back then, his star qualities were beginning to emerge. Head prefect in 1967, best all-rounder, excelling as captain of both the first 11 and first 15, achieving selection for the Auckland Secondary School's rugby team, excellent academically, obtaining a university bursary and winning the physics prize. Paul, as a student, was committed and determined to succeed. He was extremely personable, had all the leadership attributes, and excelled both academically and in sport. St. Paul's prepared Paul with an excellent all-round grounding, which helped propel him into his successful career in the medical field.
Paul has a strong family connection with 1H3 Richmond. As Sacred Hearts College, Paul's dad was head boy in Ducks in 1930. That's a remarkable thing. Paul left in 1967. Really? 1967, having had a stellar time at the college, was a foundation med student at the Auckland Medical School, graduating first year as a house surgeon at Rotorua Hospital. Deciding what area of medicine to specialise in. A surgeon wasn't his calling, as I'm told you couldn't slice bread straight. That's obviously the requirement, Paul. Pathology, dealing with the dead, didn't appeal much either, especially autopsy work. Haematology was your calling. You could see a patient, do a blood test and treat the patient accordingly. Spent the next 2 years as a registrar in general medicine in Auckland hospitals. The first 6 months being with Ted Clark, who was also a St. Paul's old boy. Qualifying in haematology in 1980, Paul set out to broaden his research skills. So like Manuka, you never stopped working at what you did and thinking about what you did and improving what you did. You gained a research fellowship in the Thrombosis Department of Medicine and Pathology at McMaster University, Canada. Gained valuable knowledge and experience in the field of thrombosis, Haemostasis. Following Canada, spent a year in Amsterdam furthering knowledge and skills. After 3 years aboard, returned to the Department of Haematology at Auckland, introduced many changes and ideas, bringing New Zealand out of the dark ages, especially when treating disorders of the veins, not least changing treatment for thrombosis from 3 weeks in hospital to being an outpatient, which is a really meaningful change. Became senior lecturer in haematology at the School of Medicine in Auckland, and then associate professor of the Department of Molecular Medicine, the University of Auckland, a position you still hold. Clinical Director of Haematology at the Diagnostic Med Lab, and its time the most advanced laboratory facility of its type in Australasia. Today, Paul is a practicing consulting haematologist, continues to make significant contributions to medicine and the health of our nation, written and contributed to over 80 medical papers and journals, served on numerous medical committees, actively involved in professional societies, which include former chairman of the New Zealand Medical Association, past vice president of the Australasian Society of Thrombosis and Haemostasis, a fellow of the Royal Australasian College of Physicians and the Royal College of Pathologists of Australasia, membership of an extraordinary number of societies, including the American Society for Haematology. Quite a remarkable man. Ladies and gentlemen, it is a great pleasure to welcome to the stage an old boy of St. Paul's, Paul Ockelford. Congratulations. What a remarkable career.
Thank you. I feel as though I'm at my funeral, actually. So I'm being told all these things before I die. So it reminds me of the sort of, that song, The Living Years, you know. Sing it loud, sing it slow or something, and do it before we all die. And so I think it's fantastic to have this evening. And I just want to say thank you to those that have organised it. It's totally humbling and overwhelming, really, that people are here celebrating this. I think it's a wonderful testament, as you said, to the college. I actually wanted to go to St. Peter's, and I got very cross with my dad for sending me to St. Paul's. And we came here because we lived over in Westmere, over in Rawene Avenue. But as you said, Dad had been here back in the late 30s, and he had a remarkable career, being Ducks twice, captaining the first 15, being head prefect and so on. And it was a bit of a hard act to follow, really. But another cousin also, my first cousin, Graham Diver, who was on one of those pictures, who was a great mate of Brian Fergus's. And he, in fact, died of chronic leukemia, which is sort of a disease that I know a little bit about. And, it normally goes for a very long time. But he had a remarkable transformation of his disease and died very young, and it was just very sad.
Tell me about your time here. What was it that St Paul's gave you, do you think? Was there a particular thing that you feel you owe to St Paul's?
I can remember being caned quite a lot.
Yeah, me too. Yeah, me too. Yeah. Oh, sometimes on consecutive days. Yeah, the second or third in a week would start to really hurt, wouldn't it?
It would, especially on cold mornings on the fingertips. I think there's always been that coming from a very small school and the need to do as well as we can in honouring the name of the school. And I think what I see here this evening is people sort of honouring that history, and I hope it does continue. Dennis Wood told me that this is the start of many more of these sorts of gatherings, which I think are wonderful because it starts to develop a tradition. So as you heard, I got into the first class of the medical school. Don't quite know how I achieved that, but last year was the 50th anniversary, so I'm fairly long in the tooth now. But that was another start because we didn't have much history either at the medical school. We didn't have what Otago had, which was a whole, many graduates who had been there for years and years. And we were sort of trying to develop our own traditions. And now, 50 years later, of course, it has those. And it has its own superstars that have graduated from there and created its own history. And I think that's what the school's trying to do as well.
It's quite an audacious thing to insist on having a public reputation, isn't it? And some schools do it as if it was second nature. Some schools spend their entire lives telling us how good they are. And other schools, like St Paul's, are shy about doing that and haven't had a public life in terms of imposing a template of themselves upon the world. And this is a very powerful message, not only to celebrate the old boys, but to tell the current boys what they're capable of. And I think it's very important that the school's doing this, not only to celebrate you, but to send a message to the world about what St Paul's is and has been and can be, right?
Yes, I mean, I agree. This is clearly not about the five of us tonight. It's about, what the school has produced and can produce and will continue to produce. People who are going to be to do well in whatever field they undertake, and I suppose the message around all of this is for people to realise their potential and to work towards that. And I think we've already heard that. Sometimes it takes a long time, sometimes it takes a little shorter time. So I guess my time was a little shorter than Dr. Hinare's, but we all get there eventually.
Yeah, that's a good message. You've certainly got there. Is it lovely to be back?
It brings back memories looking at those old pictures and sitting beside Steve. I mean, I don't know who paid Steve to say what he said, but most of it was fake news, I think, to quote Donald Trump. But no, it was old and run down, actually. The old main building, I recall, I was in I started here as an intermediate student. And then I can recall military training in the summer where we put on these old battle dresses and it was as hot as anything in February in Auckland. The old gully going across down through there and sometimes quite muddy in the winter to get to the top field when you were doing your rugby training. And there's a man here tonight who I was in one of the first 15s with is Kevin Bradley, and I remember we were training up at, where's Kevin? He's here somewhere, he's probably, oh, he's gone, there he is. So he's beside Wethington. So I was telling Kevin tonight, the last time I saw him, well, not quite, but he punched me in the face in a line out because I got in his way at training.
That's why he didn't put his hand up when you asked where he was. He knew that buddy story was coming.
I was going to say that, I think.
Yeah. Well, we're proud of you. The school is proud of you. That is a remarkable career that you have a great love of medicine, don't you?
I'm reasonably passionate about it, and it's very fulfilling. And I was sort of thinking tonight, because Bruce had talked to me a little bit about this, and I'd have to say thank you to Bruce too, because his communication over this evening was absolutely extraordinary, and his efforts in terms of bringing this together. And obviously he didn't do it by himself, but there's a sort of the way it was all put together. But I was just thinking yesterday about sort of, what's success in someone's life. And a couple of weeks ago I saw this patient who was a man like many of you. He was about to go and have a knee replacement, but there was a very mild abnormality in his blood count. So I saw him and I didn't really like what was there. He'd been sort of messed around a bit and going from sort of to different people who didn't really quite pick up on what the issue was. And so I sent him off and we did a bone marrow and a few other tests. And I saw him yesterday to tell him that he had acute leukemia. And so this was a guy that 2 weeks ago was about to have a knee replacement, go off and do a number of things with his family. And one of the difficult things is actually sitting with people like that and trying to deliver that sort of news. At 12:20 today, I got a text from him saying to thank me for the way in which I had delivered that news, and for the sort of for how I'd sort of got him and done the diagnosis, but also for the way in which the news was received. Now, that to me was success, and that made me feel quite good.
It's a great story. The school is very proud of you for obvious reasons, and it's wonderful to be here to celebrate you tonight.
Pretty heavy.
Yeah, it is. Well, you carry a lot of weight into the world, don't you? Ladies and gentlemen.
Thank you, John.
Dr. Paul Ockelford. Congratulations.